Good morning to homeopathic practitioners and students. Today's drug is LEDUM PAL. This drug is very useful in injury and rheumatic complaints and gouty complaint. The patient has rheumatic and gouty diathesis. Rheumatism or gout begins in the lower limb and ascends upward. Joint becomes seat of nodocyte, gout stone. Emaciation of the affected part. Rheumatic pains are sticking, tearing, throbbing, which is aggravated by motion, aggravated in night by the warmth of the bed. Amelioration holding the feet in the ice water. In LEDUM PAL patient, there is lack of animal heat. Patient feels chilly always. There is lack of animal heat or vital heat. Even the wounded part of the patient is cold to touch, but warmth of the bed is intolerable to the patient. Injury. It is useful in punctured wounds by sharp pointed instruments, awls, nails. It is useful in red bite, stings of insects, especially mosquito. Long remaining discoloration after injuries. Black and blue places turns green. LEDUM PAL is also useful in eye complaints. There is aching of eyes, extravasation of blood in the lids and conjunctiva. It is used in contused wounds. There is hemorrhage in the eye into anterior chamber after iridectomy. Cataract with gout. Whenever you have punctured wound to treat, give LEDUM PAL. It will prevent tetanus. Dr. Kent says LEDUM is remedy for surgeon because surgeons always get injuries from punctured needles, wounds that bleed scantily but are followed by pain, puffiness and coldness of the part. Easy strain in ankles and feet from the false. This is all about LEDUM PAL. It is useful for exams, homeopathic exams and homeopathic vivas, and also useful in practice. Do like, share and subscribe. Jai Hind, Jai Bharat.